Welcome back to 90 Day Dental Day 13. So we've got the intros out of the way, we're getting straight into the clinical. And today we're starting off and kicking off a two-part episode for smile design analysis and principles with Gary DeWood from Spear Education. Now I came across Gary doing the Spear training abroad over the last couple of years, and I've been going back and forth and really doing their programs. And one of the things that really inspired me the most about Spear, as well as many other courses around the world, is the way that they're actually running the academy and the inspiration that you get from it, where they simplify it and then stage by stage go into the more complicated things step by step. And that really made a huge difference for my own personal learning. And I asked Gary as a favour if he can do a couple of these episodes for us here so we can get the benefit from it. So we'll kick off today's first header and followed by tomorrow's to finish off the first bit. So Gary, take it away.
Hi everybody, my name is Gary DeWood. I am one of the resident faculty at Spear Education, and in fact I was one of the people who was here when we kind of started this whole thing. We're down here in Scottsdale, Arizona, and Ahmad invited me to spend a little time with you guys, only a few minutes. And the first thing that he asked me to kind of touch on, if I would, was smile design. And so smile design is a fun thing for me. It's always been a fun thing for me. It's always been one of those things where it was about how do I make teeth do the right things and be in the right place. When I was younger, we did this all on articulators. And what I mean by that is that the real planning didn't start until we kind of got teeth put together somewhere on a device where we could start to play with those teeth on the device. Because the primary thing was, let's make those teeth work against each other the best way we possibly can. I found out later that there might be some other ways to look at that. In fact, I found that out from Frank Spear, and many years ago, I heard a thing that he called facially generated treatment planning. And facially generated treatment planning was about starting with people's faces. So I'll show you a couple of faces here. Here's a face, this is Brian. And if we look at Brian's face, okay, and we have him now relax, and this is called lip at rest, and you can see that he doesn't show anything. His primary complaint is he just doesn't like how he looks. What do you mean by that? Well, I don't like when I smile, I don't show much tooth. I'm just not happy with that. My teeth look funny in there. People can't identify what it is. They can tell you what they feel and what they're experiencing. Well, if we then look at a close-up here of that, we would say, well, those teeth are in a pretty good position for his face, but those teeth aren't. His lowers are kind of up in that smile frame, and the uppers are up too high in the smile frame. We can do some things, because once we identify that, we can design something that would deal with what he was thinking he wants to have dealt with. And in this case, that meant moving some teeth around, creating a little bit of space, so that we could do some ultra conservative veneer restorations, and then going to that. And now Brian looks younger and Brian is happier. This is a patient of Frank's from a number of years ago. And if you look at her face, she comes in and she doesn't like her smile either. In fact, she's been a lot of places asking people about it. Those teeth are in a pretty good position for her face, but those aren't her teeth. Those are a partial denture. And she's been in a number of places where people said, if you want to get everything to look nice, you have to consider a denture. Well, the back teeth are not in a good position for her face. In fact, if we look from the side, you can see that if we just drew along and followed kind of where that occlusal plane would be, you can tell that those uppers are just not in the right place. So in her case, as you thought through things, you realized that you got to move some things. Now, the tools we'll talk about later when we talk about some possibilities, but in this case, let's just move the whole thing around in orthognathics. And in her case, she goes from there to there. In a case like this one, where these teeth are something this patient doesn't like either. I just don't like my smile. I don't like how it looks. Well, those edges are in a good place for her face because we started with her face. The proportion is not correct, however. So recognizing that, we can take steps to go in and do whatever it is we want to do, because we haven't gotten to how yet. We will. In this case, the how was to go in and make the teeth look like that. And we'll talk a little bit about the different ways that's possible. Smile design is about putting teeth in the right place before you think about making them work with each other. And that's not how I was trained. I was trained to look at all that stuff, but then I would sit with an articulator and I would sometimes forget things because I wouldn't remember. Now, we don't just look from the front, we also look from the side, and this is one that we've been looking at for a number of years. It's called Ricketts E-plane. There's an ideal E-plane there, and you can see the upper lip about 4 millimeters behind, the lower lip about 2 millimeters behind. If people have a concave profile, Okay, often they will benefit from having that profile brought forward, and you can do that with increasing tooth size because you can increase that curve, make it stretch out a little bit more. Convex, they may benefit from reducing that because they probably already have prominent. At least we don't want to increase the prominence of those front teeth and create what could be seen as something that was pushing out forward. Central incisors are usually about in the same plane of space as the most prominent part of the forehead, the glabella. So if you look here and drop down, that's a little bit behind. If we look at this one, you can see that's a little bit ahead. It gives us an idea where these teeth belong in this dimension because we're looking from both sides. Now today, airway enters into this as well. I don't really have time to go into all the airway things, but understand that smile design also is going to impact airway. When you put teeth in the right place in a face, in a head, you often increase that patient's ability to breathe. We look at proportion, okay, and this is a nice one to look at proportion for. And we like similar proportions. If we look at these, two of the nicest looking faces that are out there on the planet, and we go and we see their proportions are very, very even. They're also very bilaterally symmetrical. When we see differences in that, things just don't look right to us. Okay, those differences don't necessarily jump out as something. We just say, that doesn't look right to us. It could be that the lower face is too short, or it could be that it's too long. Either of those things will give us some feedback that we say, I don't necessarily like that. Smile design is part of this. Here's the 6 essential criteria that we have to go in and gather right away. Face height, lip length and mobility, buccal corridor, gingival architecture, tooth lengths, and where is the CEJ? So facial height, let's just measure that. We can do that actually on the face, but you could also do it on a picture if you learned how to measure on the picture. I think it's easier to just measure it on the face. Lip length, we get them to relax. Now we got to be careful here so they don't want to lift that lip up, but let's just get the length of the lip from below the nose. Lip mobility, when you're at rest and now I ask you to smile, how much change occurs in that lip? What does the buccal corridor look like? The buccal corridor is the position of those teeth as they sit in that smile. And what you'll notice is on the upper one that we're looking at here, that's kind of ideal. You see a little bit of black out there, but the teeth flow black nicely. You can see none when it just totally fills it with teeth, and then when it's excessive, okay, when there's a lot of space between the teeth and the cheeks. What does the architecture of the gingiva look like? And classically, if we start at the centrals, it's always high, low, high. But what we know is that what we like as human beings is symmetry. So even the one that's on your right there is not going to look so bad to us. But it could be something that a patient would tell you they didn't like in a smile because they recognize that they don't see that other look, which is the one that most people really like, the high, low, high. Let's measure tooth length. From all that data, we gather these things and then we look at stuff. We look at the facial proportion. We look at the form of the lips. We look at tooth position, gingival levels, arrangement, contour, and color of teeth. And all this data lets us make some decisions. Now, here's an important thing to remember. Dental beauty is an objective and a subjective reaction to very many things. If I just use numbers, I may not always satisfy what the patient is asking me for. So part of what we have to do is understand that patients can only tell us the things that they know. Our job is to try and relate that to something that we can manage. For instance, let's talk about display at rest. And in this article from Vig and Bruno, which is one that gets talked about the most, you'll notice that display at rest of maxillary teeth goes down with age. Display of mandibular teeth goes up with age. Okay, there it is on the maxilla, and here it is on the mandible. Now, those are norms. Again, a patient may not know anything other than to say, I just don't like my smile. In fact, many patients come and say, can't you bleach them? And somewhere in your head, you're saying, I don't want to bleach them because then it'll look worse than if I just leave it alone. Do the upper teeth follow the form of the lip? Once all the things are considered, I can finally get to teeth.
We'll leave it there for today, just simply because there was a lot of information to digest in that and to take on and take forward. And we'll finish it off tomorrow by bringing all that together as we get straight onto the teeth starting tomorrow. See you then.